There is growing urgency behind President Biden's push to vaccinate Americans against the coronavirus. Recently leaked CDC documents suggest the Delta variant may be spread as easily as the chickenpox. Delta is the dominant strain of the virus in the U.S. A federal health official tells CBS News the Delta variant is also more aggressive and breakthrough infections could be as transmissible as unvaccinated cases. This has health experts worried large-scale events could speed up the spread of the Delta variant. Hundreds of thousands of people are attending Lollapalooza in Chicago today. Organizers say it could be the largest public event since the pandemic began. CBS News' Skyler Henry has more.
New data from the CDC shows the Delta variant of the coronavirus is much more contagious than previously thought. CBS News has confirmed a Washington Post report on an internal CDC document that says the Delta variant may spread as quickly as chickenpox. CDC Director Dr. Rochelle Walensky referenced the report during her interview with CBS This Morning on Wednesday.
New data that we've seen just in the last several days, but corroborated several times, is that if you are vaccinated and you are one of those rare breakthrough infections, you actually have the capacity to pass it to somebody else.
The document states the CDC must publicly acknowledge the war has changed. It argues the agency has struggled to persuade the public to embrace vaccination and preventative measures such as mask wearing. The Post reports Dr. Walensky privately briefed lawmakers about the content of the report this week, and the new data helped prompt the new CDC mask guidelines. The agency revised its guidelines this week, saying even vaccinated people should wear masks indoors in areas where COVID rates are high.
We need to wear a mask to protect each other and to stop the rapid spread of this virus as we work to get more people vaccinated.
Thursday, President Biden announced he's requiring federal workers and contractors to be vaccinated or be masked, tested, and socially distanced while at work.
What I'm trying to do is keep people safe. I mean that sincerely. So, if in fact you're unvaccinated, you present a problem to yourself, to your family, and to those with whom you work.
The Pentagon announced the military will follow the same rules and may eventually require all troops be vaccinated. Skyler Henry, CBS News, Washington.
Dr. Julie Morita joins me now. She is the Executive Vice President of the Robert Wood Johnson Foundation and a former member of the Biden administration's Transition Advisory Board. Dr. Morita, welcome. Thank you for being with us. So that CDC slideshow mentioned that people could remain contagious for up to 18 days with the Delta variant, as opposed to that original 13 days. Can you explain why this is, and could this change guidelines for quarantining once someone is infected?
Hi, Tanya. Thanks for having me back again. Yeah, as you pointed out, the slideshow that was shared suggested that the Delta variant could actually it could be spread for up to 18 days after infection. And I think what that's a reflection of is what the data are showing. The data has showed that that people who are infected with the Delta variant, whether you're vaccinated or unvaccinated, have higher levels of virus that they're carrying, which increases their chances of spreading the disease. And also increases the duration that they could actually spread the disease as well. So both things are possible because there's a heavier load of virus that people are carrying. I think the key thing to keep in mind, though, is that people who are vaccinated are much less likely to get sick and to become infected. So even though we are seeing some individuals who are vaccinated getting infected, it's a much lower rate. The vast majority of people who are getting infected right now are really unvaccinated people.
Absolutely, and that is, what those of us who are vaccinated sort of takes to heart. However, hearing this news about these breakthrough infections, I think is important for those of us who are vaccinated to know how to respond if we do have one of those breakthrough infections. In other words, should we then quarantine ourselves for 18 days if we happen to have a breakthrough and we live in a home with children below the age of 12 who might not be able to be vaccinated?
That's right. So the CDC guidance for people who have been exposed to someone who has COVID, whether if you're vaccinated, is really to get tested 3 to 5 days after being exposed. And if you are negative, then you can stop. You don't have, your risk is much lower for transmission because you don't have the virus in your body. However, if you are positive, then there is a need to wear a mask, to quarantine yourself, keep yourself separate from people who are unvaccinated, people who are high risk for serious disease as well. The duration of that quarantine period may actually change based on increasing evidence and data that become available. At this point, the guidance has not changed, but it's possible it could change.
Very, very interesting. And of course, we don't know when you go in to get a test right now, right? You don't know if you have the Delta variant, correct? That's not part of the result that you will get. It's simply a positive or negative, correct?
That's correct, Tanya. The testing that's done and easily available to the public right now does not differentiate between which variant a person actually is infected with. And so you don't really know. All you know is really positive or negative. At this point, we're seeing a high percentage of the viruses that are circulating are actually the Delta variant. So at this point, we would treat everyone like they have the Delta variant if they're infected.
That's such good information. And then, of course, as you know, Doctor, earlier this week, the CDC changed mask guidance indoors for vaccinated individuals as well. Many people wear cloth masks, but are those substantial enough to protect one against the Delta variant and to protect, transmission from the Delta variant? Or should we be doing something else?
It's interesting. I'm having deja vu as I hear this question, because these are the questions that people were asking early on when the COVID-19 first emerged. Are masks necessary? Which masks are best? At this point, the data are clear that people who are infected with the Delta variant are much more likely to transmit the virus, and that they're carrying a lot of the virus in their nose or in their mouth region. And so wearing a mask is really important. And what's critical is really wearing the mask appropriately. So making sure that you have it across your nose, covering your mouth. There's a tight seal around it as well. In terms of what's better in terms of an N95 or a cloth mask, the key thing from my perspective is following the CDC guidance that talks about how to wear the mask and how to wear it appropriately. So we're sure that if you are high risk, that you're protected from virus, you becoming infected. And if you're infected, that you actually limit how much is actually transmitted as well.
And Dr. Morita, Israel is administering a third shot for people age 60 and up who received their vaccine more than 5 months ago. This is the first nation to do this, and it comes at the recommendation of that government's health advisors. Do you think the U.S. is headed in that direction, even though research still hasn't proven whether that third dose helps?
So we're fortunate in the U.S. to have a number of vaccines that are available to us, and there's data that have been submitted to the FDA for consideration as it relates to whether or not a booster dose is actually necessary. At this point, there's been no change in recommendations, and the FDA will look at the data objectively, will consider it, as well as the CDC and their advisory committees will look at the data and then make a recommendation on whether or not a booster dose is necessary. I think as data come in, that will definitely inform what decision and what the recommendation actually is.
All right. Well, Dr. Julie Morita, thank you so much for joining us. As always, we appreciate you sharing your medical expertise with us.
Thanks, Tanya. Nice to see you.